Hello again, welcome back to ASMR with Fertility Answers by MedAnswers. I'm Casey Goldstein once again here with Dr. Stan Najamabadi, one of our newest and best experts that we have on the app. And we wanted to talk to you a little bit about your clinic in Mexico and what that could offer patients on the app. We do have a lot of questions that come into the app about the cost of IVF. It sometimes seems cost prohibitive to couples who are looking to have reproductive help, and they don't necessarily know what other options are out there, and you guys offer a great one. So tell us a little bit more about the medical tourism in Mexico.
Sure. So we are unique that I have a IVF center in Beverly Hills, Los Angeles, and now we have an IVF center that is a US-based IVF center in Puerto Vallarta, Mexico. Actually, it's more like in Punta Mita, which is 30 minutes north.
Okay.
The advantage for the patients are when you go through the U.S. And you're doing IVF, you're spending somewhere around $15,000 up to $24,000 depending on what you do, and in vitro. Well, the advantage is that we've created a U.S.-based fertility center in Puerto Vallarta. All our equipment in the lab is duplicated there.
Okay.
I go back and forth. We have a very good fertility doctor there that takes care of patients, and we send patients from the U.S. to there, and the advantage is you get the high quality care, but at half the cost.
And obviously with the equipment coming from your doctor's offices and all of that, that is reassuring to patients who might think, oh, I don't necessarily know about traveling. There's been TV shows and movies about horror stories that happen, of course, and we want to clear up that your facility is regulated in the same way that American facilities are,
So bottom line is,
safety.
For example, here you have all these IVF centers, and some of them have an embryoscope, which is the most expensive, best incubator that you can have in a lab. Well, we have it in our Beverly Hills office. We have the exact same thing in Mexico, and it's only one of two in Mexico.
Right, okay.
And so basically what I'm trying to say is we're providing the high quality services that are provided in the U.S. over there. We actually have our embryologists shipping back and forth too. So we have staff, embryologists, and so forth being shipped back and forth to take care of patients that are from us from here. But we also have a full staff in Mexico. They are unbelievable. They're awesome. And I would say that they're as good as the staff we have in the U.S. So the quality of care and the services, if they come to our center, is at least comparable to what it is in Beverly Hills. Now, I understand there are centers outside of the U.S. where you would be uncomfortable to go to, but this is not one of them because it's basically run by me, and it's a U.S.-based fertility center.
So for a couple who is looking into fertility tourism and medical tourism, what are some things that they should look for when they are looking into clinics either in Europe or here that can help them and guide them to find a reliable and trusted resource?
Well, everybody that looks at medical tourism is looking at price. But I think it's really important to look at the price in conjunction with who's providing the service. Mm-hmm. And if you look at a board-certified fertility specialist from the U.S. with a clinic in Mexico with duplicate services, then I think that question is gone.
Okay.
Then it becomes price. But if you're looking at other people, you have to ask the question, who is this gentleman?
Right.
What has he done? What is his track record? What is there, so on and so forth. So I think with us, that question's gone, it becomes just a matter of price. But with everybody else, you do have to do your research to make sure that the place you're going to is got certain standards that they're keeping. We have U.S. standards that we keep here, over there.
Awesome. Is there a question that a couple should ask a facility that might give them a little bit more insight? Because everybody can say whatever they want really on their website, so just sort of clarifying that, giving them that question, because what I could think to ask might not get me the information that is necessary to make that educated decision.
It would be nice if people did ask questions, but the question becomes like, for example, what are your success rates?
Okay.
How many cases you're doing, and so on and so forth. Who is doing it? People don't know about the lab and the equipment in the lab, so they can't. And it's so interesting because, for example, we have competitors in Mexico, and they say a lot of things, but they don't have any of those things they say.
Right.
And for us, we do. And so I think that if you have a level of trust in what we have in Los Angeles and in Beverly Hills, and I think you know that we're running the place, so that level of trust should be there. But otherwise, for a regular patient who doesn't know much and they fly to Thailand or other countries for their care, it's going to be really hard. Whatever question you ask, they're going to give you the answers they want to give you, right? How do you check that?
Absolutely. And so in addition to the care that you guys offer in both Beverly Hills and Mexico, you and I were discussing a service that you guys have that might be better for older patients who are looking to get pregnant past the quote-unquote, prime reproductive age. And we have quite a few users on the app who are wondering what they can do and if there's something that could help, I guess, refresh everything. And
so bottom line is,
PRP.
As we get older, we're going to have less and less eggs and less eggs to get pregnant with. And a lot of times we get to a point where doctors say, well, I'm sorry, you have to use egg donation, or you only have 5 eggs, and when you do IVF, you may end up with nothing or 1 embryo. Well, we are one of 3 centers in the United States that offers this right now, and it's called ovarian rejuvenation, or PRP. And we actually do offer the same in Mexico.
Okay.
And what it is a process of getting your blood and getting the platelet-rich plasma, which has the growth factors in it, and inserting that directly into the ovary. And we have seen in certain cases, of very severe cases, there have been 10% improvement. In certain cases where it was borderline, there's been up to 50% improvement in follicle counts. We actually had a very interesting patient because a patient wanted to save money, 46, wanted to do IVF, so she wanted to go to Mexico, and she had 6 follicles. I did PRP ovarian for her prior to her going to Mexico, scanned her. In 2 weeks, her follicle count showed 13.
Oh, wow.
Went to Mexico. The doctor over there retrieved 15 eggs, 10 embryos, ended up with 5 blastocysts and 2 normal embryos, and they were ecstatic. Of course, another thing that's good when you go to Mexico is it's relaxing, and who doesn't like a palm tree and beach and
a nice
hammock?
Vacation in addition.
The patient was fully relaxed and so forth. But the bottom line is PRP, in cases where patients are getting to the point where the ovaries are not working as well, could help that patient. Now, there's a lot of people actually coming for hormonal balancing too. They're taking, getting perimenopause, and then PRP can actually regulate their cycles. So we use it for fertility and non-fertility patients.
Oh, that's interesting. Very interesting.
Yeah.
And sort of on a more general IVF versus IUI, when should a couple who is interested in assisted reproductive technology and the things that services such as your clinic offers, when should they make the move from IUI to IVF? And when should they start talking to a doctor about that?
Yeah, so in general, if you've been trying to get pregnant for 6 months and you're 35 years old or older, you should go seek a fertility doctor or see your gynecologist. If you're below the age of 35, after a year of trying, you should go. And so the doctor does an exam and says, we need to analyze your husband's sperm or partner's sperm, your uterus and fallopian tubes, and your hormonal status for ovarian reserve. And based on that, then the doctor can say, you're okay, try longer, or maybe we can try Clomid or less aggressive treatments with insemination. But if you do that for 3 to 4 months and it doesn't work, a lot of times it's better for you to move on from Clomid and insemination to shots and insemination. And if you do that for 3 months and it doesn't work, then it's time to go to in vitro. But there are cases where the patient doesn't need the treatment.
Right.
And there are cases where the patient shouldn't be going through that whole process and should really skip and go to the in vitro because they don't have time, or their tube's blocked, or the sperm is severely abnormal. So I think if they seek evaluation by a doctor and get the proper answers, and if they want, they can always get a second opinion, and MedAnswers is a great place for that, because you can get a recommendation and then you can get a second opinion from all these special doctors that are available to
including
answer
yourself.
Yeah, well, maybe, but I'm just saying special doctors. And then so we can get a second opinion, and that will, solidify your answer. So this is actually a great place for patients to get that answer.
Wonderful. Thank you so much for your time, Dr. Najamabadi.
Thank you.
And once again, I am Casey Goldstein for MedAnswers. We'll be back in a little bit with another expert, so I look forward to seeing you then. Bye.